Arthrogryposis or EDS, there are various forms of issues that could happen within the structure of your child. Not a doctor, but just in layman's terms, sort of describing the difference. Arthrogryposis is what they refer to as contractures, shortening of joint areas, contractures, and this can happen anywhere in this system. It could be the ankles, it could be the knees, and it usually happens in the womb experience. If you go back to your sonograms, you might see the actual crease going on in your child with the arms. You might see too, it almost looks like there's no elbow joints. Right, and so you'll have the elongation of the arms. So the contracture can be a bend, but it also could be an extension, but where you can't physically, in a sense, bend the hand out. That's also another sign, is you can't bend that hand out. It wants to stay in that position. Arthrogryposis doesn't mean cognitively delays, but it can mean developmental delays. And it also can mean developmental delays, and also can mean globally developmentally delayed. So there's genetics, there's environmental. Arthrogryposis is again more of an environmental thing where the contractures happened for whatever reason. And then sometimes it's associated with PMG. PMG is the extra folds on the brain, and that can cause more of the cognitive and global delays that you'll see is usually the PMG or its implications onto the brain tissue. And then EDS, and again, these are just some global things. I'm not just a geneticist, but I'm trying to explain what the difference are. EDS is almost like your ligaments are like long rubber bands that kind of got a little loose. And so you'll see where you can bring the hand back up, but it wants to be floppy, but also longer. You will notice in certain bends, it's almost like the wrist elongate, right? And it makes the lower arm almost look longer. And then they can flop it, like, you know, they'll have that kind of movement where it can go in and out. So contractures, you don't have the in and out. Right? And I know kiddos where they literally have to reconstruct the bones to straighten up the arm. You still might have elongation of the hand, depending on where it is. Arthrogryposis can also be associated with actually no muscles. It's not even low muscle tone, so you'll have those kind of things. I cannot do a full review on your baby. I don't see the face. I know you guys are always after the point where you want me to look at. I'm here to look at movement. And I need to see the whole baby, and because I need to see, despite the arthrogryposis or EDS or whatever might be going on, I'm here to show how your baby is organizing movements. Because again, rolling over will be hard, or if it's more of a low tone thing, EDS thing, rolling over might be difficult this way. And so I need to get your baby to have optimal development, and I need to see how your baby's organizing movements. I cannot stress enough. I know you're just trying to show me videos, and I'm not trying to complain in any way. When you are concerned that your child has delays, get them out of that swing. Get them out of, they need to be on the floor. I get it if you're making dinner, put them in or whatever. You've got to watch container time. You don't need to add to the lack of movement that could be happening. But I wouldn't think twice about having 2 major doctors in, but 3. What you're looking at is you want to make sure, first of all, everybody goes to neurology because they think it's the brain, but a lot of this is actually genetics. So I still wouldn't skip your neuro appointment, but I would also have the genetics appointment lined up because it's your geneticists in many cases that are going to do this. And sometimes too, I know people think that there's such thing as a microarray and stuff, but there's a lot of genetics that can be done, a lot, and some have to be specific. So basically, you know, the geneticist is going to come in and like, okay, we have this. We're going to specifically look for this because they're not that. What they're looking for is not in a microarray. They might have to do a muscle biopsy or skin biopsy. That is surgery. That's a little bit more extensive, and then the skin cells and muscle cells get sent out to very specific labs like Baylor or something like that. I've gone through all this, so again, I'm talking with experience, not that I'm a doctor or whatever, and I'm sure things have changed since what things have gone on with my son Graham, but that's what they're looking for. But what people don't realize, your genetics might be right here, and they biopsy right here, and this is the do we do it so young? wait till they're older, and it presents more, because when they're doing biopsies, a lot of the DNA replicates about 17 times faster than normal DNA. Again, depending on the genetics that we're talking about. So those are some things you might be looking at. The other person that I'd be talking with is an orthopedist. An orthopedist is a doctor of the bones. And so what they're looking at, because right now you might not even be thinking of the hips and the knees and the feet and everything else that could be involved with a subluxation or contractures. Those are all for diagnosis. You still have to work with the movement. So I need more videos on the movement. You've got to work on getting your dance card full with those 3 doctors. You want neurology, genetics, and orthopedists. They all have their specialties for a reason, and they're going to hopefully coordinate care, but that's what you're looking at there. Get on docket. Some of these guys might, or I say guys, women, men, professionals might be busy for 6 months, because now you're really getting to high-end specialty. So you want to make sure you get the appointment. If your pediatrician has to order a stat, then that's what they do. They want the child seen. But lots of times stat doesn't happen if they're not medically compromised, meaning breathing, respiratory, anything like that. And that's what you have to look at. Thanks.